Hello everyone, welcome back to another episode of Dun Dun Dun, the Sacred Synthesis Conclaves. Today is another of our regularly scheduled conclaves that are designed to bring to you information, education, activation in various ways. Today is no different. Today we are going to be discussing 5-MeO-DMT and its use with mothers. And there has been a recent study that was just published last month that illustrates all the various benefits of 5-MeO-DMT. And before I get into that, I'd like to introduce myself. My name is Benjamin Moore. I am a co-founder here at the church and also the current co-executive director with my beautiful partner, Cynthia Cremblett. And it's been such an honor to be providing education and information to you so you have more tools and more ways to connect and to expand as you go on this ride, this journey of life. So, with that being said, if you are watching this video from YouTube or a clip from a social platform, we would really love and appreciate it if you would follow us and come and find us inside of our school community. Inside of our school community, we are having conversations and different ways to connect so that you can, again, have more tools in your toolbox to expand into the greater being that you are. So please take that into consideration. So without further ado, let's begin with today's talk. So there was last month published a study that outlined a trial that was conducted between 2023 and 2024 with 10 mothers. And so the label of this trial is called Inhaled Mebufotenine for Adult Patients with Postpartum Depression. And if you're wondering what is mebufotenine, well, that is a pseudonym for 5-MeO-DMT. And what is 5-MeO-DMT? Great question. 5-MeO-DMT is a tryptamine, as they'll call a serotonin analog. So it is a very similar molecule to serotonin. And it binds in your serotonin receptors and certain serotonin receptors inside of your body, in your nervous system, which is also located inside your body. And also, in addition to your nervous system, these receptors can be found in your skin, in your bones, in your smooth muscle, and other organs throughout your body. So what is happening? What is going on inside of your body when this is taking place? Well, these molecules go to the cell, and instead of just binding to the receptor site on the cell, which is what serotonin does, serotonin essentially binds to the receptor and then sends a signal in the cell to do a behavior. And 5-MeO-DMT actually goes beyond that. It penetrates the cell wall. It also binds, but it penetrates the cell wall, and it seeks a few different places within the cell, primarily the sigma-1 receptor, which is responsible for intercellular repair and also repairs the mitochondria within the cell. And if you weren't aware, the mitochondria is the microorganism that was originally attached to us to help ourselves become humans, and that is inherited from the mother. So it's quite interesting that this talk today is about mothers, and really the focus is how 5-MeO-DMT has been shown to benefit mothers who are going through postpartum depression. And I always want to caution reducing these important compounds to medical interventions. They are that, and they do provide that, but that's not their only use. And so as we get into this conversation, you'll start to see the benefits beyond. So what took place? So we had 10 mothers that had postpartum depression, and on a scale, on the major depressive disorder scale, up on average was a 28. And that's pretty high in the realm of depression, right? You want to be a 0 is the ideal level. And so 1 in 5, just some statistics here, about 1 in 5 mothers experience some levels of postpartum depression. And the current interventions are talk therapy or antipsychotics like SSRIs. And typically with SSRIs, they take 4 to 6 weeks to begin to work and require a very close observational period for the transition, because SSRIs can lead to major effects, major side effects, such as suicidality and increased levels of depression. Interesting, right? And also SSRIs have a below 50% efficacy rate if you look at the scale. So not really great approach, but it's the only thing that we sort of haven't have any knowledge of in our current medical model. And so this new trial, this test trial, actually only takes 1 day of treatment. It's an in and out patient treatment and requires no taper, and produced a 100% remission rate within 8 days of these 10 mothers. So everyone, all of the mothers that went through this trial experienced a drop to below detectable levels of postpartum depression within 8 days. Some of them showed the improvement within 2 hours post-treatment. Pretty wild. So let's go into the mechanics of what they did. So the 5-MeO-DMT, or mebufotenine as it's coined here, was a vaporized approach. So they didn't inject it or insufflate it. It was vaporized. And what was interesting, it was vaporized in a volcano vaporizer. So anyone that's come from the cannabis space or, basically the cannabis space, understand what this is. It's basically a vaporizer device that fills a balloon with vapor, and then you breathe it in. And this is a device I have a lot of history with in my younger years, hanging with my friends. So it's actually quite beautiful that this made a full circle, right? These tools of discovery and exploration have become very powerful and potent instruments of change. So thank you to the volcano for continuing on this journey to bring these things forward. So what happened? What was the approach? So these mothers, they went through what was called a peak experience scale. So basically they had a tapered dosing starting with 6 milligrams up to 18 milligrams. And they were going through the experience and would report back if they had basically a mystical experience or a breakthrough experience. And that would give the researchers the information that they needed to say, okay, you had a full breakthrough, right? Because that's what they're looking for to be able to shift their perspectives. And so the dosing all happened gradually over 1 day, which is very similar to how we work in ceremony, where we taper the dose starting low to kind of get in the body and then move up into consciousness to break through that, the focus on the suffering and allow the medicine to help the individuals change their perspective. Yeah, so what was the safety picture around this strategy? Well, it was a clean, medicalized environment, so it was very sterile. And what they saw here was no real adverse events. So the highest adverse event they had was headaches, and there was no confirmed correlation between the 5-MeO-DMT and the headache. It was just what they had observed. And so once they went through the practice and had their experiences, within 2 hours, some of them had a reduction of depression, which is in line with what I've observed. But I don't necessarily want to create a pathology around what people's experiences are. So I'll just go through some of the specific numbers. So 96% average reduction of depression by day 8. And 100% of the participants received both response and remission. We said more than that, but I'll keep going. The effects were visible within 2 hours of the final dose, of course, and there's a 56% improvement in maternal functioning, covering things like bonding, caregiving, and psychological well-being in the mother's bond with the child. And suicidal ideation dropped from 30% of the participants to a baseline of 0 at discharge. So 30% of the participants had suicidal ideations, and by the time they left, 0. What does it mean to go clinically from moderate to severe depression to remission in a single week? Question one, right? Well, I can tell you that is almost unheard of. You know, you can consider maybe one or two an anomaly, but across the board, to go from major depression to remission is unheard of in our current clinical models. So if that speaks to you at all, wow, that's a very powerful awareness, and something that I've seen again in our experiences. And why is maternal and functioning important as a metric? Because depression in a new mother isn't just an internal state. It's a joined state, right? Because a mother is with a child. So these energies, these vibrations are being transmitted. And I can tell you a short anecdote that when my son was born and I was deployed downrange, I can remember when I would get the opportunity to call my then wife and check in and connect. There was a point where I could feel there was something going on that brought fear to me. And at the time, my son was about two and a half months old when I first went downrange. He was new. And by about month 3 or 4, things started getting weird. So I reached out to her mom to have her check on her because I was concerned, and I started reading all this stuff about postpartum depression. And, you know, sometimes mothers do things that they regret because, you know, life just happens. And yeah, depression is really, really difficult without strategies, without people, without interventions. And then at that time, there was none of this, right? There was SSRIs or going to treatment. You know, those things also, you know, you can see the records of that. So anyway, it's something that it was near and dear to me. So this is why this conversation is very important. And obviously I'm not a mother, but I am a son of a mother, and I do have children. So I know the mothers of that, and I'm just observing what's going on there. And one of the most interesting observations I had seen was during maybe, it's probably 4 or 5 years ago when I was going through this process with discovering and expanding in the psychedelic space, and my then wife had decided that she was open to sitting with 5-MeO. So she worked with 5-MeO and went on a deep dive experience with Bufo. And the one gleaming thing that I remember was that she turned over after the experience and looked up and said, "I am not my son. I am not my daughter." And at that moment, she said that I released them, like that there was an interrelational merging that had happened. And along the way, she sort of lost herself. And I saw the decoupling happen. And this speaks, I think, to many mothers and probably fathers as well. But the conversation here is about mothers, that there is an identity coupling that happens, and that's through love, right? And I think it's important for us to decouple that experience, decouple that identity, so that we can have our own path, so that you can have your own path of dreams, of wellness, of achievement, and then you can trickle that down to your kids, teach them, help them integrate with life and not be, interrelated with them and have your identity conflated with theirs, because that also creates confusion in them. And so, thank you for following me on that sidebar. But yeah, I think it's important for us to understand the actual what's happening on the ground. And so, some of you may be curious or concerned, especially if you're mothers. What about breastfeeding? What about if I'm breastfeeding? Well, this study addressed that concern. So they tested breast milk, new mothers who were breastfeeding. They tested the breast milk for different times after the experience, and they tested levels. They said the levels of 5-MeO metabolites peaked 1 hour post-dose. So there was a 1 hour peak in the breast milk. They could detect the metabolites in the breast milk, and then within 8 to 10 hours, it had lowered to an undetectable level. And by day 2, there was 0 metabolites in the blood, even with these lower, more highly precise detection equipment. And then the most concerning, right? Because 5-MeO DMT is not toxic or harmful, but the most concerning metabolite that they were looking for was bufotenine. So bufotenine, that's what can get you in trouble, right? Bufotenine is neurotoxic at high dose, and it can cause you problems. And so that was what they were looking for in the breast milk, to make sure that it wasn't causing any harm to the baby or even to the mother. And there was no bufotenine was detected at all at any point, not even after the dosing, not even at the highest peak of the metabolite in the breast milk. So, which is great. So that just points towards moms can continue to pump, and within several hours, they will have cleared out breast milk, ready to feed their baby. And so why? So we'll talk a little about why the speed, the mechanism that they use, why this matters, and how this works in a much better way than, we'll say, this classical other treatments. So mechanistically, 5-MeO-DMT is a strong 5-HT1A receptor binder. I don't know why I'm saying it that way. 5-MeO-DMT has a strong affinity to bind with a 5-HT1A receptor. And it's very distinct from SSRIs, because SSRIs take, many weeks, 4 to 6 weeks, sometimes longer, to come fully online, right? So there's this big adjustment period. And again, in that period, there can be rapid changes. And some of them border on psychosis. So when you start taking SSRIs, you'll notice, if you have ever done this, your psychiatrist will be wanting to monitor you, and you provide feedback regularly. So until you get to that point where you can be in a sustainable dosing, and that is because there are risks of you going to the dark side, to getting your depression worsening and increasing suicidal ideation, and also suicidality increases as well. So, that is, a clear indicator of the contrast here. This is a rapid one-day treatment where we can taper the dosing up. So go from 6 milligrams to 12 to 18 milligrams and go to a peak experience and then complete. And the key here, which is actually beautiful, and it speaks a lot to what's going on in the body, is that this was done without any integration. Right, this measurement was taken without any therapeutic intervention. This is just the medicine. And the FDA wanted to make sure that this focused on the molecule itself, and did not have anything. There was not any effects from therapy, because the FDA isn't designed to rule on therapy. And this is where the whole MAPS debacle had taken place. The FDA is not ruling on therapy. So if you have a compound, great. So this here is super important, because in the conversations that are going on right now, everywhere, the main narrative is that it's not the psychedelic, it's the integration. And this here study is showing you that it is in fact the psychedelic that's making the shift. Now, integration is another conversation. And I don't want to go too deep into that conversation here and now, but I'll just touch on it. Integration is an approach to bring in and integrate experiences in one's life, and has nothing to do with psychedelics. If we should be integrating all the experiences we have. All it's doing is bringing it into awareness. Okay, did this benefit me? Did this harm me? Okay, how can I further continue this behavior if it's something that's beneficial? Or how can I bring this story in and sort of crystallize it inside? But it's not this transformational thing that is tied or interrelated to psychedelics. Again, we should be integrating all the experiences. If you get into a car accident, you need to do some integration. If you have a baby, you need to do some integration. If you graduate, you need to do some integration. And again, it doesn't have to be this arduous thing, right? It is a small practice of bringing this awareness, this exciting event, into yourself and continuing on your journey. So you have a path that you're blazing for yourself. Otherwise, unless you just want to be willy-nilly flopping around and free, that's great as well. But, so bringing it back here to this study, this was done without integration. This was just to study the compound itself. And it provided a complete remission in all 10 moms within 8 days. So, wow, that speaks volumes to actually what's happening in the nervous system, and that it isn't coaching, and it isn't integration or therapy. It's just this compound. So, wow. What does that mean? The question, maybe you're asking this, like, what does it mean for this approach that it worked at this level without integration? Well, that creates a floor of improvement, right? So if we're seeing that we can get this level of improvement without any coaching or integration, well, what happens if we couple it with coaching or integration, or something that helps us to, again, crystallize the experience and then stack the experience to continue to grow and to expand? Well, again, it creates this level of experience, right? So I believe all of us are on a different level per se, and our baseline is what it is, where we currently are. So no matter what our mood is, we have a baseline. And if our baseline's here and we're living life and we have a peak experience, it can increase our baseline. And with integration, we can keep our baseline here, and then we can keep going higher and higher. Now, if we don't have any form of integration, tools or strategies to bring the experience in and continuing to move and grow with that experience being a catalyst, then perhaps we go here, we have a peak experience, and we're elevated, we're doing well, and then we perhaps drop back down to our previous baseline. And in some cases, even lower, because it starts to create like a pendulum swing. Think of rhythm, right? So one of the Hermetic principles is the principle of rhythm. So it's like a pendulum. Things swing one way, things swing another. It's just the nature of physics. And so in that same way, if we are just having peak experiences, blasting off, coming back, it creates this ebb and flow. But if we're integrating these things, we can stack them, just like stairs, just like the stairway to heaven. So, that being said, integration can obviously help to build, right? To build our baseline, to build our foundation, to keep us growing bigger and bigger and bigger. And so in that same thread, we're talking about integration, coaching, So what does that look like when it comes to a clinical trial versus a ceremonial container? Well, this clinical trial didn't have any of those components. So it was literally like, come in, get your medicine, get your treatments, do some surveys, leave, do more surveys down the road, and measure the results. And so in ceremony, there's many more variables to empower and enhance the experience. Oftentimes, if you're a part of a community, ceremony will be in a group, so you'll have peer support, you'll have a community to communicate with, contact if there's something that's going sideways, and then support if you need it. So like our community at the Sacred Synthesis, that we have created a group container that can support your journey. So when you're working with 5-MeO-DMT at home, when you are working with it with your friends or your family or others that are on this journey with you, and you need support and you need perspective, you can tune into the community, ask questions, tune into any group integration calls, or if you're part of a protocol, be part of that flow together with the group or community, and get support that way, and you'll get insights from each other. And as we know in this life experience, we're all learning from one another, and our ancestors have passed down these wisdoms for us, tips and tricks, if you want to call them that, hacks, ways to get there faster, to overcome the challenges faster, because they've experienced it. And if we can trust them, if we can lean into the community, if we can lean into the group, we can overcome the challenges and not feel alone, right? That's one of the key indicators for depression, is like being withdrawn, being alone, I'm not good enough. So, go in to have your peak experience and then join in the community conversations, right? And, the key aspect here is, having that support structure that we have created at the Church of the Sacred Synthesis. And I want to just, before we close out, just drive home that this study is just that, right? It is a phase 2A clinical trial that measured 10 moms and found remission in all 10 moms after 8 days with mebufotenin or 5-MeO-DMT. And what does that mean? So that means that if you are a mom, or if you know a mom, that you can expect a high level of success while working with 5-MeO-DMT. And there's various approaches to this compound. And one approach is a deep dive ceremonial transformational experience. And that is typically what has been known across the spectrum of this compound. And they also call this compound the God molecule. And so what we do here at the Church of the Sacred Synthesis is offer 5-MeO in a couple of different formats, in the Jaguar Light Wand and in the Unity Mist. And both of these are low dose approach. So with the Unity Mist, it is a super low, like microdose approach. And it can give very subtle somatic relief and provide clarity and connection to the now moment. And it lasts about an hour, so it's really designed to kind of drop into meditation and help you open your channel to your higher self. And with the light wand is a vaporizer device. So it's actually an oil vaporizer, and you can vaporize the oil. And you start with a low dose. You can start as a microdose, but it is a more rapid onset and rapidly metabolized. So it's short acting. So you can drop in with it, and then you can actually titrate that dose and put yourself in a state that you feel comfortable being, but also allow your consciousness to be expanded so you can see and experience life perhaps from the eyes of God, from the eyes of the all, while still being embodied. So there's a lot of wisdom there in that state. And we offer monthly ceremonies where we take you through the protocol with movement and with breathing, and then through our recommended protocol, which we've found that helps us connect in a way that is meaningful. And so if you have any desire to tune into those, they're all located within our school community. And we broadcast those live once a month, so you can register. Right now, the next one is upcoming is July 26th, and you can register at low-5.com/Jaguar and tune in with us, go on this journey with us, and just see what it's all about. Now, with these ceremonies, 5-MeO is not required. So it's designed around 5-MeO, so you can, again, get that textural experience and take it with you in your own practices. But we would love to have you one way or another, because there's teachings, there's activations, there is breath, there's Kundalini yoga, and some awareness practices which can enhance whatever journey you're on. And again, if you're watching this from YouTube or from another platform, please follow us and show us that if you appreciate this content, that we should continue making it. And then alternately, join us on school. Join us in our community. Communicate with us, talk to us. We're in there, it's live. There's tons of questions. People and members are providing feedback and asking questions, and really creating a vibrant, burgeoning community. And beyond that, you may wonder why I have got this little eclipsing sun over my shoulder. And we are going to be presenting at the Eclipse Fest in Iceland next month. And if you're going to be attending, we'd love to see you and interface with you there. We've got some really rad presentations, which I won't get into just yet. Cynthia and I are still finalizing the languaging around that and playing in that energy of creation. So with that being said, thank you all for joining and being a part of this important conversation. We love you very much. And if you have any feedback, if you have anything that you'd like to share, you can find us. You can find there's a feedback form on our site. You can send us messages directly and we will respond in time. So with that, I bid you all adieu and have a rad rest of your week. Peace.